Understanding and Managing an Enlarged Heart, your guide to better heart health. Have you ever heard the term enlarged heart or grown heart? Perhaps a doctor or health professional mentioned that your heart is dilated after reviewing an X-ray or imaging test. But what does it really mean to have an enlarged, grown, or dilated heart? In this guide, we will explore this condition in detail, shedding light on its causes, symptoms, severity, and treatments. By the end, you will have the knowledge necessary to take actionable steps towards maintaining or improving your heart health. Let's dive in. First, let's clarify some terminology. Enlarged heart is a layman's term often used in general discussions, but the medical name for this condition is dilated cardiomyopathy. This condition is characterized by an increase in the size of the heart, specifically the chambers, often linked to underlying heart disease. As the heart enlarges, it gradually loses its efficiency in pumping blood, leading to heart failure, where the heart cannot meet the body's demands for blood and oxygen. A dilated heart usually develops in response to one or more underlying disorders. These could include chronic untreated hypertension, past heart attacks, genetic conditions, infections, or valve diseases. Understanding the root cause plays a pivotal role in shaping the appropriate treatment strategy. In the U.S. and globally, hypertension, high blood pressure, is the primary cause of an enlarged heart. When blood pressure stays high over a prolonged period, the heart must work harder to pump blood against the resistance in the arteries. Initially, this leads to structural changes in the heart, like increased muscle mass. Over time, however, these changes may manifest as dilation. What makes hypertension particularly dangerous is its subtlety. Many people are unaware they even have high blood pressure because they don't feel sick. However, this silent condition can profoundly affect heart health. Detecting and managing blood pressure is critically important in preventing heart enlargement. Another significant cause is ischemic cardiomyopathy, which can occur after a person suffers multiple heart attacks. The affected heart muscle becomes scarred and less capable of contracting effectively. To compensate, the heart dilates to maintain adequate blood flow. However, this compensation leads to further weakening. Proper treatment of past heart attacks, including medications, surgeries like bypasses, or stenting, is critical to halt this chain reaction. In regions of the Americas, Chagas disease, caused by the parasite Trypanosoma cruzi, contributes significantly to cases of an enlarged heart. The chronic inflammation from this illness damages heart muscle, resulting in progressive dilation and symptoms like arrhythmias. Other potential causes include nutritional deficiencies, e.g. low iron levels, heart valve disorders, fatigue, persistent tiredness that interferes with daily life, swelling edema, not just in the ankles and feet, but also in the abdomen in severe cases, orthopnea, difficulty breathing when reclining, nocturnal dyspnea, waking up gasping for air during sleep. If these symptoms resonate with you or someone close, it's imperative to seek medical advice immediately. Detecting an enlarged heart involves several key diagnostic tools. Chest X-rays. While X-rays may hint at a dilated heart, they are not definitive. If anything unusual is spotted, further investigation is warranted. Echocardiograms, echo. These ultrasounds of the heart provide in-depth analysis of its size, structure, and pumping efficiency. Cardiac MRIs, advanced imaging tests offering detailed insights such as blood flow and muscle integrity. Electrocardiograms, EGs. These may detect electrical abnormalities or structural changes. Pinpointing the exact cause ensures better treatment planning and improved outcomes. The straightforward answer is yes, but severity depends on how early treatment begins. Left untreated, a dilated heart progresses, significantly reducing the heart's ability to pump blood and shortening life expectancy. Studies indicate that if heart failure continues without medical intervention, life expectancy diminishes, often to less than 5 years. However, early and proper treatment can dramatically alter this outlook. Modern medicine offers interventions that stop or reverse heart damage, enabling patients to enjoy long and meaningful lives. Heart failure treatment involves medications that improve heart function and alleviate symptoms. ACE inhibitors lower blood pressure and reduce heart strain. Beta blockers control abnormal heart rhythms and improve efficiency. Angiotensin receptor blockers, ARBs, a safer alternative for those intolerant to ACE inhibitors. These medications work in tandem to enhance blood circulation and reduce the heart's workload. In more advanced cases, non-drug treatments are often required. Cardiac resynchronization devices. These advanced pacemakers coordinate heart contractions to improve output. Heart transplants. For patients who meet strict criteria, transplants offer a new lease on life when other treatments fail. Medication alone isn't enough for long-term improvement. Patients must make lifestyle changes that can work wonders. Fluid control, limiting liquid intake to 1.5 to 2 liters per day, reduces fluid retention and heart strain. Salt restrictions. Keeping daily sodium intake to around 1 gram prevents fluid buildup in the body. Embracing these changes alongside medical treatment fosters improvement and offers sustained relief. The potential for a cure depends entirely on the root cause. For instance, conditions like myocarditis, temporary inflammation, can sometimes resolve completely. However, genetic and chronic causes may not offer a cure, only improved management. Modern medicine focuses on mitigating symptoms, halting disease progression, and ensuring a better quality of life. Advances in care mean that many patients live fulfilling and highly active lives, even with medical supervision. At this point, you might wonder what you can do to prevent issues such as heart enlargement. Awareness is crucial, and some practical tips include regular blood pressure monitoring. Catch problems early and treat high blood pressure proactively. Annual health screening. Stay alert for signs of heart disease or conditions like high cholesterol. Stay active. Exercise not only strengthens the heart, but prevents contributing risk factors like diabetes. Healthy eating. A heart-friendly diet includes vegetables, whole grains, and lean protein sources while avoiding processed sugars and excess salt. Even small, consistent habits can make a tremendous difference. Receiving a diagnosis of a dilated or enlarged heart is understandably overwhelming, but it is not a reason to despair. Remarkable progress in cardiac research has transformed outcomes for patients. Advanced medications, innovative devices, and tailored lifestyle changes mean more people than ever can live long, fulfilling lives despite this diagnosis. If this article has been educational, share it. By spreading awareness, we can collectively improve heart health for countless individuals. Always remember, your heart is the engine that powers your life. Give it the care and attention it deserves. Take the time to consult with healthcare providers, adopt healthier habits, and encourage loved ones to prioritize their heart health. Together, we can make a difference.